Welcome to this special episode of This Just In Radio. We're broadcasting live from the ViVE 2023 conference in Nashville. I want to thank CHIME and DHI for inviting us to their theater. I'm your host, Justin Barnes. We have a terrific leadership roundup show this morning. With CHIME, the focus is always on the CIO and CSIO. So I brought together a great group of friends and CHIME members to join us today. I look forward to all of them helping us wrap up ViVE 2023 with just what some of the priorities are for the CIOs and also hopefully some of the conference highlights along the way. My first guest, Dr. Dan Nigrin, CHIME Board Chair and also CIO of MaineHealth. Welcome to the show, my friend.
Thanks so much, Justin. Thanks for having me.
Great to have you here. So, how long have you been in town?
Since Saturday.
Awesome.
Long, good stretch, though.
Yeah. So how's ViVE been for you so far?
ViVE has been fantastic. There's just so much energy at the conference, and so great to see all of the vendor representation here, spanning both innovative, new, young companies as well as more established ones, and obviously all of the CIO and CISO leadership that you mentioned. So fantastic speakers, presentations. Obviously, the entertainment here in Nashville is phenomenal. And so it's just been a fantastic several days for us.
Yeah. So this is my first ViVE, but obviously been a conference for a long time, and the energy here is just unparalleled. I mean, people here, the thought leaders here, the vendors here, the innovators here, as you mentioned, some of the people who are new to the market, but with phenomenal technology and innovation, and some people have been around for 20, 30, 40 years, but still innovating and making a big difference. And so it's what's here, it's phenomenal.
And one thing that I really love about the event is that it was pretty manageable. It's the right size. Walking from one end of the show floor to the other is achievable within a few minutes.
Got it.
And I also love the fact that again, some of those smaller new entrants to the market are right next door to the more established ones, and so it's a little bit of a leveling of the playing field, which I think is important.
It's actually a very good point. And Steve Lieber brought up yesterday on the show that they actually may limit it to say 10,000 or so. So we keep this intimate, we keep this at a nice high level, and to your point, you kind of level the playing field, because some of the other conferences, someone might have a almost like a 80 by 80 booth, and then you kind of drowned out that 10 by 10 innovator. So, but here, kind of everybody's on a level playing field. So it's a great point.
Yeah, and not to mention, it allows us to go to new cities that we haven't had a chance to go to before.
You got it. Now we'll make a plug for ViVE next year in LA. I'm very excited for that.
Absolutely.
So, what are the top agendas? You as the CHIME board chair, what are some of the top agenda items for you guys this year?
Well, certainly continuing with the success of ViVE is one of those. This has been a huge strategic priority for us as an organization. Expanding internationally is a very big effort for us. Our advocacy efforts in Washington are as important as ever. And just getting back to the core mission of CHIME, which is education of our health IT leaders, absolutely still top of mind for us and what we're focused on. Healthcare is undergoing a huge transformation now with IT and some of the innovative new technologies that we're seeing all around us here, and there's a lot to keep up with. And so I think CHIME plays an incredibly important role at helping our leaders do that, and getting them up to speed on all of the new opportunities available to us.
Absolutely. No, CHIME's been around for many decades, great at the leadership level, certainly for CIOs and CSIOs, but you guys are also, I know, branching out and spreading out for a lot of the top leadership within health systems and organizations.
That's right, yeah.
So you have a very unique perspective as well, being the CIO for a Maine Medical Center in MaineHealth. So tell us, I guess, from your perspective, what are some of the biggest challenges that you're facing, either within your organization, not giving you any inside strategy, but as challenges as the CIO?
Well, I think one that is unfortunately a recurring theme with all of my colleagues that I speak with is just the financial challenges that we're under. It's never as though we had buckets of money to play with, right. But things are as difficult right now as honestly I can ever remember them in my 25 plus year career. So that's an incredible challenge because we're being asked to do more. In many ways, IT is the solution to some of these problems, right? Allowing us to be more efficient. And yet we've got to get there on a much, much tighter budget. And so that's an incredibly big one right now. Coupled with that is, of course, the workforce challenges. In our post-COVID world, we're struggling to fill clinical roles, administrative roles, IT-centric roles. Flexible work and remote work has been a boon for many of us, but it's also meant that people have much more ability to, take their skills somewhere else and not move and uproot their families. And so that's an ongoing both opportunity and challenge for us. And then finally, the clinical community is really struggling as well right now.
Yes.
Doctors, nurses, clinicians of all types are just burned out. They're challenged to, again, do more, see more patients, do it with 80% of their pre-existing workforce, and that's tough. And so when we layer on technology that's not optimized for them, that just makes the struggle even worse. So we've got to do everything that we can in our power to simplify the technology, remove those obstacles, and sort of help as best as we can.
Yeah, almost as a follow-up to that, I would like to talk about some best practices, but you are also being in Maine. I mean, that could be a little bit more unique with, like, are you doing incentives to bring people in, or you have a large enough pool in Maine to pull from, or do you actually send people to move to Maine? Gorgeous state, an amazing state. I'm actually from Boston, so I know Maine pretty well.
Yeah, no, one thing we do have is our environment, our landscape. It's just beautiful. So we just need folks to come for a little bit, and then invariably they end up staying. Yeah, our health system is based in Portland, Maine. Fantastic city.
Beautiful city.
And so. But yeah, it is definitely a more rural state. We have an incredibly strong team now, but recruiting is a challenge for us.
So what are some of the best practices? I like to show my focuses on key strategies and best practices for CIOs, but C-suite executives to thrive, hopefully in healthcare. What are some of the things that you might share with some of your peers? Either they're maybe new to the CIO position or maybe new to healthcare, but they could be some great innovators from outside of healthcare coming in. But what are some of the best practices you would share with them from your perspective?
For one, I refer back to my clinical background. I think it's incredibly important if you're not coming to the role with that background, you've got to make best friends with as many clinical folks as you can and immerse yourself in it. You can't do this job sitting in an office in an executive suite. You've got to understand the things that your customers essentially are going through. And so I think that's an incredibly important step that new executives in their roles could take if they don't come to the table with that background. And two is to recognize that our roles are unique in that we have to collaborate with our peers. There's very, very little, if anything, that we can do on our own as technology leaders. We've got to partner with all aspects of the health system to get things done. And so working in partnership is a really important skill, and it's something that you can actually work on. It comes naturally to some folks, but not to others. And so I think understanding that and working on it is an important skill. And then finally, just to continue to educate yourself. Healthcare is a complex environment, and obviously the technology within our systems is changing very rapidly. So things like ViVE, organizations like CHIME are incredibly important to stay plugged into, because I think that's where you get that education.
Yeah, so as a follow-up to that really quickly, do you have a work group or another conference that you say, well, it's a must on your schedule, or something that you plug into? Is there a work group within CHIME or somewhere else in the organization, is in the industry that you plug into personally? Well,
I think the CHIME Fall Forum is an incredibly great experience and setting. Many of the kinds of educational talks that we had here at ViVE, multiply that times several fold at the Fall Forum. So I think that's probably, for me anyway, the premier event that I'm sure never to miss. Beyond that, there's lots of sort of technology-centric organizations out there, and they have their routine conferences, and I think, tapping into as many of those as possible is always a good idea. Again, the financial pressures on us now are such that I know that many of my peers are having to limit what they go to, right, just because of travel and conference expenses. So sometimes you have to prioritize.
Excellent. Now, CHIME Fall Forum, totally agree. I've heard that a few times now, so very exciting. Dr. Dan Nigrin, thank you so much for joining us today. Great to have you on the show.
Great.
Take care.
Thank you.
Thanks, my friend. Excellent. Chelsea?
Great, thank you.
Thank you, my friend. Welcome to the show, Chelsea.
Thank you for having me. How are you?
So it's a Chelsea Arnone?
In the old country, it would be, so I'll just...
I heard you on Monday saying that.
Arnone.
Arnone, Director of Federal Affairs for CHIME. So I know we got some breaking stuff that we're going to talk about. Is that right? Cool. But before we get there, how's CHIME for you? How's ViVE been for you this year?
It's been fantastic. It's my first time here. I joined CHIME in June of last year, so it's wonderful.
Very cool. And where'd you come from?
I came from another company that's in healthcare. I've been in healthcare for about 15 years now, so.
Excellent. So what broke this morning, and what do you want to talk about?
So what broke this morning is the implementation of the PATCH Act, which was passed as part of the Omnibus last year. So the FDA was instructed within 90 days, which is today, March 29th, to implement the provisions to require medical device manufacturers to provide certain cybersecurity items in their pre-market submissions. So they are now going to be held to a very high standard for providing cybersecurity SBOMs and this happened, literally at 8:45 this morning it was released. So we're not shocked and surprised. We are looking forward to it, but it is now in effect.
Excellent. Fantastic. So you bring up cybersecurity. I know it's one of your main focuses. What do you want to kind of share regarding that? Some of your thoughts and what's happening with the White House released their first national cybersecurity strategy last week.
Yeah. So it was actually a little bit earlier this month. The White House released this administration's first national cybersecurity strategy. We're, absolutely thrilled that they're paying attention to the critical infrastructure sectors. It did not mention the HPH sector, ours, so it didn't mention it directly, but it's something that is, of course, with the COVID-19 pandemic, they've been targeted greatly, our members, so we are, we were encouraged by that. And also late last year, the Treasury Department indicated that they were considering a catastrophic cybersecurity coverage plan, sort of perhaps to be modeled after the National Flood Insurance Program. So we were very supportive of a potential catastrophic cyber offering from the federal government. And we are paying attention to the implementation of the CHCIO law, which is mandatory reporting from the critical infrastructure sectors, and that will be released sometime later this year, the proposed rulemaking.
Okay. What's the, touch back on the cybersecurity aspects with the, insurance, backstop, all that kind of stuff.
So the insurance marketplace for cybersecurity for providers is becoming, it's no longer soft market.
That's great. I've been part of it, I know. So that's what I'm very interested in that.
So we, for those that have, been hacked and are uninsurable,
right.
They are, this would be a great offering or opportunity for them. They're absolutely willing to go to get this. They're willing to meet all the needs, but then they are just denied. And it's cost prohibitive, it's very expensive, and it doesn't always cover, it actually usually doesn't cover the full cost of an attack. So if it costs $60 million to a member, they'll cover maybe half of that.
Okay. So you talk about, I know we've off air a little bit, data privacy and the FTC enforcement of the health breach notification rule. Talk about that a little bit.
So the FTC has authority under the health breach notification rule. They've had it since 2009, but they have not utilized it until this year. So we were encouraged by that. There's a lot of activity going on in the administration, paying attention to consumer privacy as a whole and very broadly, and of course patients are consumers, so when it comes to that, it's something we're absolutely paying attention to. And those sort of the Wild West of health applications that are possibly having your sensitive health information,
yes,
then they need to keep it secure, and those that have not kept it secure will be subject to fines, penalties, and then certain provisions and policies that the FTC deems appropriate.
Okay, excellent. So I know we've got the annual inpatient perspective payment system IPPS rule coming up. Talk about that mega rule?
Rolls off the tongue. It rolls off the tongue.
Just rolls off the tongue, exactly.
It is one thing I can count on, sort of in DC, like death and taxes. It is coming out generally the same time every year. It is an easy read, 4,000 to 6,000 pages on how hospitals are going to get paid, and sometimes some fun surprises in there from CMS, the Centers for Medicaid and Medicare Services. So it's going to be probably within the next, I would guess, 2 weeks or so, and I will be heads down in that and kind of figuring out what sort of, promoting interoperability program requirements are coming out and what changes they're making there, and any other, fun surprises they may have.
I assume TEP's going to be part of that, you would think, in some capacity? I
think that that's going to be included in another massive rule from ONC that we've been waiting on. It's been under review since September, meaning it's like imminent. So it could be out in the next couple of weeks as well, making my life really, really fun and busy. Yeah,
that's right. So anything on the interoperability front that that you see coming down the pipe, anything from a regulation standpoint, regulatory standpoint, or what do you think?
I think there will be pieces in IPPS that have to do with interoperability and increasing it.
Okay.
Hopefully incentivizing it in a way that we agree with, and reporting and meeting the PI program requirements and making it. It's all part of there's lots of moving pieces here from different agencies.
Absolutely. What about the public health emergency waivers and flexibilities? Anything new there, or?
So the unwinding, it's officially the COVID-19 public health emergency. The administration indicated, correct. It's over. COVID's over. So fantastic news. It will be over on May 11th. So those waivers officially. Officially. So the waivers and flexibilities that were offered, certain states may be applying for extended waivers, so that, we have a
California, I believe.
Yeah, we have a cheat sheet on our website, so you can where to find the latest agencies and sort
Actually, that I would love for my listenership. I get a lot of questions around that. So where can they specifically go? Is there a link? Is there an area on your website?
Yes, we are. So our public policy, if they aren't signed up for our debrief, email policy@chimecentral.org. We are always available to answer questions. We respond directly to that. All those emails goes right to our team. Mari and my coworker Cassie, who's here with us.
Mari, my guest on Monday.
Mari, our fearless leader.
Hey. And we had a good time on Monday. So.
She's fantastic. So they can find it on our website. It's free, available to anyone. Our members, hopefully, are checking it.
Excellent. Yeah. No, it's obviously you guys are a phenomenal resource. So I guess in closing, are you done with the conference today? And now what do you hope to do this afternoon or finalize here while you're here on the floor?
I'm heading back to D.C.
Awesome.
So I've been here since Thursday, so I'm heading back to D.C., and I think I'm going to have a lot of reading to do in the next couple weeks, so I should probably get some stuff done.
Excellent. Chelsea Arnone, Director of Federal Affairs for CHIME, thank you for joining me today. Welcome to the show.
Thank you so much for having me. I appreciate it.
Take care. Safe travels.
Thank you.
Thank you. Is Justin? I don't see Justin. Perfect. Roxie. Welcome to the show. Welcome back to the show, Dr. Roxie Mooney.
Thank you for having me again.
Love it. Got to catch up with you yesterday, so I know there's a lot of great things happening. Digital health advisor and also a best-selling author. First, how's ViVE been for you?
Fantastic. So I was there at the kickoff in Miami last year, so it's great to be here again. It's great to see more people here. So it's, growing and diversifying. I'm usually here for more networking and meetings, so it's like speed dating for me the last couple of days. It's been great.
Yeah, actually, I met you last year, I guess this time when you're coming off of Miami Beach, you and our good friend Mike, Mike Mosquito. So we actually had a great time there, and I know ViVE last year was phenomenal, so I had to join it this year.
Yeah.
So tell me some of the trends that you're seeing out there, healthcare, health IT, digital health. What are you seeing?
There's so much, right? There's just an explosion of innovation and new trends taking place. Just a couple that come to mind is virtual care. We're seeing a lot of hybrid of virtual and on-site. Also virtual first and virtual only.
There you go.
And the virtual only care, I think, is broadening. You're seeing more global companies, more companies from outside of the United States entering into the U.S. market with their virtual only models. And we're seeing a lot of growth there. I also think personalized care, right? AI, ML driving a lot of personalization in care. precision medicine. The other one is retail healthcare, which is, really going to be disrupting things, right? With new players like CVS and Amazon and Walmart providing primary care and kind of changing how we think about where we're getting care from and how we're getting care. And I think consumerization is definitely being peppered into that. So we're getting better experiences for patients. And then also, all of that obviously is to drive increased better outcomes.
Yep. Excellent point. So, my show loves to focus on best practices, key strategies. So what are some of the, what are 2 or 3 that you've seen out there, maybe here, you've been working on over the past year, different innovations, workflows, work groups? What would you share with my audience?
Yeah. So many years ago, I decided to embark on getting my doctorate degree, and I came across this statistic that 95% of innovations that are brought to market fail.
Yes.
And I was just blown away because I thought, how in the hell are we going to transform healthcare if most of these innovations aren't going to get into the hands of the people that need them the most? And so, after reading hundreds and hundreds of peer-reviewed journals on every aspect of commercialization, really there are a handful of strategies that started to percolate that were really key for success. So one of them is building out an early adoption strategy. So most often when we are thinking about our commercial strategy or our go-to-market strategy, we have kind of a one-size-fits-all. Right. And so, a strategy or best practice for success is really rethinking that, using the diffusion of innovation model that's been around since the 1950s and building our strategy based upon that and kind of tailoring our messaging, our product configuration, our sales and marketing all around early adopters first, and making sure that we're penetrating that segment of the market and then shifting and building another go-to-market strategy that's tailored more to the mainstream market, because your messaging, your product, your sales, your marketing is all going to be very different. And I think that is a key, a fundamental to commercial success. The other one that comes to mind is co-creation. So I know we do a lot with human-centered design and design thinking, but when I think about co-creation, I think of it as something that's not only critical that we are involving patients and key stakeholders in the creation of those products and solutions, but also everyone in the ecosystem. One of the things that we really struggle with right now is there's no shortage of innovation, right? I mean, it's coming out of our ears. But what we are really have a gap in still is adoption. And there's a lot of, even when, people are their innovations are being added to a network, or hospital systems are agreeing to purchase your solution, still being able to drive adoption utilization is a big struggle for us. There's a lot of different variables at play. So if we're co-creating those solutions with all of those key stakeholders, we are essentially applying change management throughout the entire process. And so we're going to see much greater adoption.
Love it. So let's talk about something really controversial. We caught up yesterday, and that we both agreed, we don't have to name names, but we also agreed that we have a lot of great innovation. I totally agree that 95% don't make it to market. Most 95% of companies fail for a lot of various reasons, even I discussed in the past. But how do you go about helping these health systems, providers, even patients for that matter, navigate innovation, embrace the best innovation that's integrates into their total workflow? Because we know it can't be just one piece and then in little components, but we need to make sure that we're adopting the very best innovation for our care strategy, part of our care continuum, but also not staying too complacent just because of old bad best practices, I guess I would say. We're trying to be nice.
Yes, absolutely. So there's definitely, and I think the ViVE conference is kind of reflective of that, where, at the conference, we're seeing this merge or integration between kind of old mindsets and legacy systems with new and fresh and innovative thinking. And so we've got to figure out how are we going to work together, because there's value to both camps, right? We really need to have an understanding understanding of how everything is really structured and the complexities of interoperability and the complexities of a multi-sided market, but we cannot let that hold us back. You see, I think there's several booths that talk about liberating the data, right? We cannot allow that to take place and not leverage the innovations that are really in the market. There's so much innovation that is really struggling to actually provide value and real benefit today because being blocked by
Absolutely.
a lot of legacy players in the marketplace.
Yeah, we don't want to stifle innovation. You're right, absolutely right. This show has done a phenomenal job, ViVE, and health in general, and even CHIME, has done a phenomenal job harnessing innovation, highlighting it. And as my very first guest, Dr. Dan Nigrin brought up leveling the playing field. So we don't have 80 by 80, 100 by 100, 120 foot by 120 foot booths drowning out the 10-foot booths, when the 10-foot booth might have far superior innovation that can be integrated into care strategy, that can make a big difference in your community. So we get to highlight it all here at ViVE.
Absolutely. And I think that it's critical because if we don't start playing better together,
That's right.
those non-native healthcare companies are going to come in and teach us a lesson.
Own us. You got
and
it.
own us, right?
Right.
I mean, Walmart is on the path to launch 4,000 primary care clinics in the next few years.
Yeah. Wow. 4,000.
It'll be the largest primary care provider in the country, Walmart.
Yep. Wow.
So think about the influence, think about the understanding of consumer engagement. It's a game changer.
And also, we've got about 2 minutes left, but I'll have you back on air because the other topic we discussed yesterday was about the younger generation and how they're engaging healthcare, and they're engaging healthcare on their devices, which is not integrated into an overall ecosystem that we thought we were all building this phenomenal ecosystem. Back to your last point. In the last 90 seconds, not to put any more pressure on you, what is a key strategy or trend that we need to look out for and navigate in 3 to 5 years from now?
Well, God, I hope this one happens way before 3 years, but I'm going to say longevity.
Yep.
So there are a number of different players that are working in a different sector in healthcare around prevention, around proactive care. It's also personalized, but it is longevity. So one of the things that I always have found fascinating is our whole lives we spend a lot of time building financial wealth,
Yes.
right? Most of us we have a financial planner,
Right.
and we are building all of this wealth, right? Look at your 401ks, look at all of your investment portfolios.
Taking a hit lately, though.
Yes, absolutely. No doubt about it. But we are not building a longevity plan
Right.
for our future. So many leaders that I've worked with over the years have built incredible legacies, have incredible worth, right? Financial, they've sold many companies, and then they retire or they don't retire, and they get diagnosed with a brain cancer and they die in 5 months. So we have to build longevity plans if we want to be able to enjoy the fruits of our labor.
Fantastic. Dr. Roxie Mooney, thank you for joining. Best-selling author. We'll have you back.
Thank you.
Thank you.
Appreciate it.
Take care. Another doctor, Dr. Justin Norden, partner GSR Ventures. Welcome to the show, my friend.
Thank you, Justin.
Good to have you back.
First
First of all, how's the show been for you, my friend?
ViVE has been fantastic. I have to confess, I missed last year.
So did I.
But it's really been wonderful. Being able to be in one space together, bump into everyone that we already know here, and everyone made it out.
Yep.
Nashville is not a place I've come to a ton from living in the Bay Area, but it's been absolutely wonderful.
Yeah, I think
love
it's
the show so far.
7,600, 7,700. I'll get the final count here as we wrap up the show with some of the leaders here. But the energy's been phenomenal. Actually, my first guest, Dr. Dan Nigrin, brought up how he is, how he, as a CHIME board chair, but also in general, how ViVE, CHIME and Health came together for ViVE have really leveled the playing field. So you don't have these 120 by 120 foot booths drowning out the 10 by 10 innovators, when the 10 by 10 innovators could be the next big thing. And so this really does level the playing field. And they're also mentioned, Steve Lieber yesterday mentioned that they're going to cap this probably at 10,000.
Oh, really?
So we can keep this manageable. You can actually walk the show. Dan also brought up how you can walk this show in a matter of minutes, rather than some of the other larger conferences where it takes us, an hour to get from one end to end, and you probably miss still half or more of the vendors and people. And So this is going to stay very manageable, where we can, kind of see and highlight a lot of the innovation, what's coming, what's working. So very exciting. What have you seen for cool innovations around here?
So the thing I'm keeping my eye out for and really starting to see is things really integrating AI. Yep. So that's my background, my personal interest. While I'm a physician by training, I ended up actually leading an AI company before finding my role now at GSR Ventures, where we focus on early stage health technology. And with everything happening now, as we kind of look at the broader technology ecosystem from where I sit at the heart of Silicon Valley, AI and these new technologies are really going to change everything. And so that's what I've been keeping my eye out for at the conference. And we're starting to see it. We're seeing companies use computer vision, looking at fall detection, other things like that, IoT in the hospital. We're starting to see it on the analytics side. What can we really predict? What can we, get ahead of the curve in terms of what's happening for a patient in decompensating, other things like that. And I think, in general, technology, we're a little bit laggards, I would say, from a health system perspective,
right.
and for many good reasons.
Yes.
But these things are some of the most powerful, exciting innovations I think we've really seen in decades. I think we're at the beginning of a moment in history in terms of what AI is capable of, what's happening now with all the announcements over the past few months. And so that's really what I'm keeping my eye out for in healthcare, and where is the right way to deploy this technology? How can we do so safely? And how can we do so really benefiting everyone involved in the healthcare ecosystem? And so it's been fun to see the early days of that.
Yep. I think it balances a little bit what you've seen here, but with some of the trends. But I guess when you look at, I know when we caught up yesterday, natural language processing and how that's evolving with ChatGPT and 4, and talk a little bit about that. What your research is.
So this is an area, and I'm teaching a course at Stanford on generative AI in medicine. The first one we've had at the medical school now. It's starting in about 10 days, and roll back 6 months ago when we were talking about the course, it's, these things are happening. We've had foundation models, transformers for a few years now. But, really since November when ChatGPT was launched, the whole world started to pay attention. Wow, look at how these things are doing. And people started applying it in so many different ways. So let's roll back to November. ChatGPT was launched. GPT 3.5 was the version underlying that. And people tested it. How does it do on step 2, the final exam of, medical school training? Turns out it was able to get around 59%, just passing second percentile. Hey, that's interesting, but hey, it's not nearly as good as doctors or anything like that. Fast forward just a few months. GPT-4 released a few weeks ago. We tested it. We tested it with our team at Stanford first, and then actually Microsoft released their own version, doing it in a more formal way. It jumped from second percentile, 59% correct, to 89% correct, 95th percentile, bottom to the top of the class in just the span of a few months. Already, these technologies are incredible. As you start playing with them from an aspect of, coding and helping with computer science, understanding, patients are starting to use this today. Obviously this isn't what it was intended to interpret their own labs before their doctor got back to them, interpret their own, imaging results instead of waiting for the doctor to call. These things are out in the wild today and are doing incredible things. And so just that pace of innovation, even if you froze it, forget GPT-5, forget these next models coming out, already what's possible today is transformative. And we really have to catch up, I think, as a field of medicine to say, what is the right way to use these things? What is the regulation that should come around these models? When is it a device? Should it qualify? What is the FDA's and others' role in terms of these things? But I think the power is transformative, and that's what excites me so much, because historically we've thrown bodies at the problem in healthcare. Right. We've hired more, we've tried to put more people around it, and we really need to use technology to help unburden our providers, right? That is like the number one issue across every health system in the country.
You brought it up first thing, yes.
We need more providers. People are burnt out. And so I really think these technologies can offload a lot of that burden. I don't think they're going to replace any providers. Clinical care is a totally different beast. Empathy, connection, technology has nothing to do with that. But can we offload some of that other administrative burden? I really think we can.
Fantastic, Justin. So and a couple, maybe a minute on this. What's going to be significantly disrupted, do you think, with ChatGPT? What do you think? Oh my gosh, this is a massive disruptor. This has come out of nowhere. What innovation?
One innovation coming out of nowhere, how patients even seek and start to interact with the healthcare system. For years we've had Dr. Google, right? You're coming in to see me in my clinic. You're already looking up what you have, what you think it is, what you think you want. that has already shifted overnight. Now we have ChatGPT, patients coming in with their own doctor. And for the most part, it's a lot better, or it's giving a much more compelling, detailed answer, even if it might be wrong. And so immediately this is happening now, and we need to be ready for this as medicine.
Wow, fantastic. So what do you see as a key strategy or trend that we must be ready to successfully navigate in 3 to 5 years from now?
I'm going to sound like a broken record, but it is really this. I think the systems that are looking to see how these tools are going to impact themselves, looking to see how they can, aid their providers specifically as a focus, those systems are going to start to kind of leapfrog and then lead the way for those who aren't, especially when this is a multi-year process. You can't start in 3 years saying, oh my gosh, now we need an AI strategy. What are we going to do? You're going to be behind the ball. So I really think it's today starting to say, what are the tools and things that are coming out? What are the pressing issues? What can we do safely? What can we start to do first? And then how does that build over time? But this really is the key trend. You can call me out, in a year if I'm wrong, and say, no, yeah, Justin, you're completely wrong. AI, none of these tools did anything.
No, I see the evolution.
That's where my bet is, and that's where nearly all of my attention is today.
So final question, looking out over the remaining part of 2023, what do you see as maybe outside of maybe ChatGPT, innovation or a sector that you said, we're going to go after that. We want to go, we see that as a burgeoning area, so much opportunity there. What sector is that?
One of the sectors, so we actually did a survey of other, the largest survey of digital health venture capitalists. We did this last year. We published it in November. And I think the one area that I think, as well as my fellow peers, that is ripe for innovation is the area of oncology. There is so much need in terms of what can be done in the oncology and kind of transforming and updating the patient experience. This is one of the toughest moments in life when someone gets a diagnosis, and we need to do better supporting those patients along that journey. Everything from, the initial kind of interpretation of what's happening to, when someone's going through chemo, how can we be closer to that patient? How can we intervene earlier, prevent that ED visit, and really create kind of a far, far better experience overall? And so I think oncology, for good reason, isn't the first place where health technology went, but it really is a place for innovation going forward.
Okay. And now looking out over even the rest of, some of your, I guess, sectors, I'll put you on the spot. You like the lab space at all? Some good innovations happening there. We actually they brought it up. Two of my guests brought up the lab interoperability yesterday, and so that's my very first guest brought that up. And I was Dee Davis from Sequoia Project, and I was just that was her first key point of how the integration with labs and how it's expanding. So I was very excited about that. But what are your thoughts about the lab space?
So especially, we're going to combine it with a few things. When you think about kind of more virtual care, when you think about trends towards consumer, people kind of getting care where they want, when you think about what these AI tools are going to do in terms of kind of offloading or taking that early triage for patients, all of this still involves labs, right? Labs have only grown in importance as we have more labs we're able to do, next generation sequencing, specialty labs, et cetera. And it's, underlies so much of clinical decision making. And so we need easier ways to get labs, making labs more interoperable, making it easier to order, make it easier to order, custom specialized labs. And so this is really going to be the backbone for everything we do kind of across healthcare going forward. And so companies able to go in, make this process easier, update antiquated process, make things completely interoperable, make things seamless across the consumer experience to the provider experience. This is really going to be a key infrastructure for really how we unlock the next part of healthcare. So we're really excited to see what companies innovate in the lab space.
Thank you, Justin. Yeah, and 70%, the CDC, that famous CDC stat where 70% of our medical record is made up of lab results, and 80% of the actual file is lab tests, literally. Now, my other friends, Mark, made a joke that's because it's all paper and it takes a lot to print it all off. But anyhow, no, very exciting. Justin Norden, thank you so much for joining us today. Partner, GSR Ventures. Thank you, my friend. Welcome back to the show. Thank you. Great. Okay. I text him, so. David, welcome to the show, my friend.
Thank you. My pleasure to be here.
Excellent. Thank you. Great to have you here.
Good to meet you.
So, first of all, tell me, David Finn, Vice President AEHIS, AEHIT, all a great CHIME. Tell us how the show's been for you this year.
It's been fabulous. We went through last year, and I was here last year.
Excellent.
And you don't think it can get any better, and it's better. It has been fantastic in terms of just the discussions we're hearing in the cybersecurity pavilion, the traffic on the floor, and certainly the panels and speakers on the stages have been incredible this year.
Yep. No, and actually, I want to make sure I make a plug for LA next year. ViVE LA next February. I think it's February 25th or right around that time frame. So I'll certainly be there. I assume we'll be broadcasting live again, Roberta, from ViVE in LA. So I'm very excited. So first of all, tell us about the CHIME boot camps and for the CIOs and CISOs and CSIOs and all that.
Well, the CHIME boot camps originated many years ago, and they weren't called boot camps then. They had a program called Information Management Executives. And
oh, yes, I remember that. Yes.
Yeah.
Right.
And so it was really, the CIO was barely a title in healthcare 30 years ago when CHIME was formed. In fact, it wasn't. And so as they came together to discuss the issues they were finding with bringing technology into healthcare, they realized that they needed, they needed to come together. Why rebuild the wheel, reinvent the wheel? And they started sharing, and the IME evolved into really more of a boot camp situation. It's a 3.5-day, very personal and intense program, and what they discovered is, well, they can teach you some things. What they can't teach you is your network and who to call and all those things, and that kind of bonding is what took place. I think the last number I saw is they have over 4,000 graduates now of the CIO boot camp, and several years ago the CIOs got together and said IT's getting really complicated in healthcare. And so we spun up these other organizations, security being the big one because of what's happening in the world, and we created a CISO boot camp modeled on the CIO experience but focused on security executives.
Yeah, obviously phenomenal supporter of that, but also the importance of collaborating with your peers, learning from your peers, learning from associations. There's so much happening. It's getting more complex as you mentioned, and we've got to learn continuously. So
and it takes more and more players. IT used to be able to go do IT, but if IT is doing it without the clinicians, without the revenue cycle people, without patients, it doesn't make any sense anymore. It's not digital health.
Yeah, I'm a big proponent of education, staying on top of the trends, but also, networking and learning from my peers.
Absolutely.
This is CHIME, phenomenal organization, and we have several in the healthcare industry that that create these work groups, create these opportunities for us to learn, to collaborate, lead, and just get better at our craft. And also with the level of complexity and innovation, technology, and opportunity, it's just critical to all of our career paths. So love what you're doing there. What are some of the, reliable reports saying about healthcare and cybersecurity? And, did the pandemic see any different trends of cyber attacks in healthcare?
Well, I will start with the bad news. Things are going to get worse before they get better.
They will.
I believe that 2023 and 2024 are really going to be pivotal years for security, particularly in healthcare. We've seen a number of announcements come out of Washington, both from the White House as well as the Health Sector Coordinating Committee already this year. And I believe with the new National Cybersecurity Program that Joe Biden launched earlier this month, and what we're seeing from Senator Warner's office and what he intends to do, there will be legislation and there will be requirements for the first time in healthcare around security. What happened in the pandemic is it took a kind of tenuous situation, and it in many sectors across the globe blew everything up. The remote work, the remote care. We had to change the model of healthcare delivery, which changed the model of IT delivery, and it opened up the sector, and it opened up new attack vectors, a magnitude of additional attack vectors. We had temporary docs manning, hospitals that were tents in parking lots. We had visiting clinicians to help staff those emergent situations. And it told us where healthcare was going, but it also told us we didn't have the security and privacy in place to go there yet. Right.
No, excellent point. Now, a couple of my guests yesterday really hit on that. Just the level that we need to step up over the next couple of years. Where these nation states, they're going to come at us. They're going to come at us more, to be honest, unfortunately, every day. And so we've really stepped up our game internally because we're going to get hit. And it's just a matter of when, and then how do you handle it, and then rectify it. So you've been a hospital CIO and security expert for a long time. So what are some of the priorities that you recommend to somebody new to this or just trying to become better?
We always have to become better, and there will always be new attacks. And the bad guys, unfortunately, are not constrained by budgets and taxes and policies like we are. But some of the things are not as difficult as we like to pretend they are, and don't require as much money. But it does require the effort. And I think the big thing is just cyber hygiene. Healthcare is notoriously bad at patching and updating hardware and software. We look at the legacy medical devices that some can't be patched, but there's other ways to address that aren't necessarily investing in a whole new medical device inventory. The thing that kind of amazes me is we still don't focus on training and awareness.
Right.
Or if we do, it's not very good training and awareness. You get your onboarding security lecture, and then every year you have to take the online course. But training to be effective has to be personal, and it has to be entertaining. And that's the thing about security training. Anything we teach you about security at your hospital also applies directly to your own personal privacy and security. And of course, what we carry now in our pockets is tenfold the compute power that landed men on the moon. And we've got to think about that. There's so much processing, there's so much data. Your operating system is sharing data with other apps that we don't know about, and those are the things we have to start thinking about. And that's the story, and that doesn't always take a lot of money. It takes some time, but we have to focus on making people aware of what the risks and issues are.
Excellent. If there's a work group or a forum or a show or something, where can someone engage, or where would you point someone to say, hey, join this, participate here, and you can get a leg up. You can actually learn. I know we talked about the boot camps a little bit, but is there something else into the work groups or any forums or anything like that that you say, hey, go there?
Obviously I will look to CHIME and AEHIS first. Yep. But there are, particularly for a lot of small providers, and we actually have them in the cybersecurity pavilion this year. The Health and Human Services Office of the CIO has a department called 405D, which is a section of the CISA Act of 2015, and they've developed tools and training and education. They're about to launch a training for cleanicians, video training, and so you don't have to have a huge IT or security department, but this is material developed by the government working with the private sector. Hundreds of providers participate in these work groups, and it's an incredible source. The other areas, the Health ISAC, healthcare and public health is one of the 16 critical infrastructures defined under executive order. And so under the Department of Homeland Security, the CISA group had to commission a private nonprofit called the Health ISAC, and they provide materials, they provide alerts, they provide vulnerability alerts and training to security and non-IT and non-security people. So there's resources that were unavailable 5 years ago that it doesn't cost a fortune. You can choose to belong or not, but you can get basic information and share that through your organization.
Love it, David. Thank you so much. A lot of great wisdom there. Thank you for that strategy. David Finn, thank you for joining us today, my friend.
Thank you.
Have a great rest of your conference.
I will.
Excellent. And I'll text Rasu real quick here. Theresa Bell, co-founder, president, and CTO of No 2.
Yes.
Love it.
Got the name right.
Excellent. Thank you. Welcome to the show.
Thank you, Justin.
So first of all, how's the conference been for you?
Yeah, it's been fantastic. I spent some time walking through yesterday, and I took a minute and I said, what I'm feeling right now is gratitude. We've spent the last few years in,
Yes.
confinement and everything else, and our ability to be back together as a group is great. And took that time just to say, this is important. These types of things are really important. So
They are.
I'm glad to be here.
Yeah. When'd you get back? When'd you get in town?
Sunday night,
And where'd you come from?
Boise.
Excellent. Yeah, no, I think this is my third or fourth conference since the pandemic. But I mean, every time it gets better, you see more and more people. We're coming together. We collaborate at a much quicker velocity, and you learn a lot more. So, a very exciting. Completely.
And the world's tough, so it's good to have times together.
It is tough. You're right. I totally agree. So, No2 was announced as one of the 6 qualified QHINs.
Yep.
Why is a QHIN important, and who'll be serving on that network?
So when we started the company, I thought about that question. When we started the company now 12 years ago, we had 2 kind of commitments to the industry. Is one, you looked at all the noise at that time that interoperability had around it, and it's gotten even worse today, is that we would simplify that, and we would go through and connect everywhere in healthcare and simplify that process. And every time healthcare starts a new initiative, we'd be in front of it and listen to it. Is it going to be real? And with QHIN, it became apparent to us, we've been in front of it for a long time and had our ear to the ground, that it was going to be very important. And this time it feels, significantly different. And we chose that as part of our commitment to our customers and our partners, which I'll touch on who those are. We knew that we had to be in front of it and expand the offering to include QHIN connectivity services. We've, as a company, again, when we started the company, one of the primary tenets of the company is that we would go to the overlooked parts of the market to have true interoperability and true connectivity, which is what we're focused to. You had to be serving all 4 corners. I always say to our team, it's all 4 corners of healthcare, and that includes bringing to the, we always talk about the physical therapist that sits in the strip mall. They deserve healthcare connectivity just like the largest health system does. In the United States, they're caring for patients just like everyone else, and you had to make sure that we were bringing a model not only technically but economically that could serve those markets and bring them forward. So that's a commitment we made. It's obvious that QHIN, this time it's different, and we've future-proofed our platform by becoming a QHIN. It's been a hard work effort thus far, but we're going to stay to the track. It's very important.
So I'm pretty sure I've worked with your company. You guys also work with you engage companies and help them with security training and so forth, correct?
We do not.
No, okay.
We do not.
I've worked with your organization.
Not that I know of.
Yeah.
Maybe we do.
So tell me about TEFCA, and why is TEFCA going to be a great solution for interoperability in our industry?
Well, if you look at I think if you ask every person on this floor and what interoperability was and the problems with interoperability, you get a different answer literally every time. I call it healthcare a bandwagon industry. We've seen it over and over again that the next interoperability initiative or the next connectivity initiative was going to take care of issues that we've been long hoping for, and none of them have, right? They've all been additive to the problem, including FHIR, which is now a 10-year-old protocol, but they're all part of the collective equation. So QHIN solves the fundamental problem that we've needed to solve for years, and that's connectivity. And getting the information to just move. Before we get to some of the harder problems like semantic interoperability and things such as that, you just got to get the information to move and move at scale and be able to do that. We've seen success, I think, enough with like Care Quality Commonwealth that it's obvious that those types of models work, and now we do that at a national level. Really important. So we've gotten to the fundamental problem. We call ourselves the power grid. That's what it is. We're just keeping the electricity or the data flowing and solve that at scale for the nation. Excellent. Fantastic. So what do you feel that hospitals should be doing right now as they plan to participate in TEFCA? What some best practices you'd share there? Well, hopefully they don't have to think about the technology part of it, because that's where the industry's gone wrong every time. I always say interoperability has been the worst marketing campaign for the last 10 years because we're so focused to the acronyms. And as a provider, whether it's a large health system or a small provider, they shouldn't have to be focused to the to the technology part of it. So hopefully their EHR vendor is taking care of that. We know, for instance, Epic's becoming a QHIN, and it just becomes a natural outcome of the technology that they've invested in. Where I believe their responsibility sits as a health system, in particular, is the influence that they carry to the rest of the community, is spend that time working with community members. So whether it's the post-acute industry or EMS or whoever it may be, making sure that their community partners and those that they're collaborating for care coordination with are also looking towards a QHIN, because those have often been the markets that have it, and thus we've continued to fail. So I think they have a responsibility there as the influencer in the market to push their communities forward to become a QHIN. And the second piece is also to educate themselves. It's a paradigm shift, right? So if we look at how interoperability has been done in the past, it's all been point-to-point, expensive interfaces. I think I'd heard you just ask somebody about lab interfaces. I mean, everything's been this education around HL7V2 and what that does. And there's certainly going to be a continued need for that in a narrower focus, but it's really about educating yourself on this paradigm shift to broad connectivity. And what can you do with the tools that you have? It's amazing. I'll sit with health systems and they don't understand their tools that they're just sitting on within their EHR, and what they could do to solve real problems, do more with less. They're all forced with very, tight budgets, is that you've got the tools you're sitting on to let the data start flowing and drive efficiency. So I think that's their responsibility, less about the actual implementation of the technology, but how to utilize it and see it at scope.
I love it. Yeah, you brought up Care Quality and Commonwealth, and I'm a co-founder of both those organizations. So I'm glad that you brought them up and love it. And I believe everybody should be engaging. Yeah, thank you. So I guess if you have to give like one piece of advice to a health system about to engage this process, you said, hopefully it's not the technology piece. Where would they start? Where do they go to learn more to basically be prepped for some of this? Like, is there a specific website area, point where you'd point them to? Where would you say, here's where you need to go?
Well, I'd start with their EHR vendor, because it's all about, for me, QHIN is just the back end, right? It's the edge that is actually performing the interoperability. So educate yourself on what tools you have within your EHR. That's where we see the biggest downfall right now, is work with your EHR vendor, get to know your technology stack that you have. And then if you want to, move past that, is understanding the capabilities within QHIN is go out to the TEFCA website. I actually don't know it off the top of my head. I should. But go out to the TEFCA website, understand what protocols are behind it if you want to go that deep. But start with what you can do within your own workflows, and then understand the community around you and how to see both sides of that workflow come to life.
It's excellent. I believe you can go to healthit.gov and they'll tell you all about it.
Thank you very much, Jess.
You got it.
Did you start that one too?
Yeah, no, I did not.
Okay.
Therasa, thank you so much, Therasa Bell, for joining us today. Have a great rest of your conference.
Thanks.
Thank you. Bye. And then Rasu, we're ready, my friend. Dr. Shrestha. How are you, my friend?
Great, thanks.
Great to see you.
Yeah, you too.
So did you speak this morning? Did I see that?
So this was yesterday.
Yesterday?
Yes.
What did you talk about? I saw a lot of the social media stuff. So.
What I talked about was how do we illuminate the dark side of the moon?
Love it.
Yes, that's what I talked about.
Okay. Well, indulge us.
Yeah, sure. So it's interesting, right? So we had been in a meeting with Best Buy Health about maybe 2+ years ago, and we were talking about the things that we could do to specifically impact health at home. And I talk about home is where the health is.
Yes.
Right, and how we need to really broaden our aperture from the bricks and mortar facilities, the patient-centered approach to care that we've had now for centuries at a time, to more of a person-centered approach to care. Move dramatically away from the episodic care models that we've embraced now, not just decades, centuries at a time, to more of an always-on, ubiquitous, continuous care model. And the comment that someone made in that amazing brainstorming session that we had was, the home really is the dark side of the moon. We discharge the patient.
That's a great point.
Patient goes home, and we know nothing.
Right.
And the patient is disconnected and is in the dark until the time that the patient, more often than not, shows up back in the ED.
Got it. That's right.
Costs escalating through the roof. Quality is down. Experience is horrible. And we said, all right, we got to illuminate the dark side of the moon. So we're working with Best Buy Health, marrying it together with our hospital at home program at HRM Health, which is part of Advocate Health.
Yep.
Yeah. It is the largest hospital at home program in the country.
Wow.
We're bringing in RPM, we're bringing in logistics, we're bringing in a number of capabilities that Best Buy and Best Buy Health are known for. So you know Best Buy for their Geek
Absolutely.
Squad.
Yeah.
So think about the evolution of the Geek Squad to the Health Tech Squad.
Yeah.
And then, through all of the learnings that we've been putting in place, as well as the proof points, 6,600 patients treated through our hospital at home program. Just amazing.
It is.
Right. So a lot of different opportunities, but yeah, excited to share that story.
I love it. So how's ViVE been for you? When did you get in town, and how's it been for you?
Yeah, ViVE's been great. Yeah, it's been a couple of days now in town, and I arrived just in time to have dinner at Aaron Martin's house. So
That's great.
right? Aaron and I are good friends, and I knew him, through Providence and all the amazing work that he did there. And he's now back at Amazon, and he had a number of really amazing people for a cookout.
That's cool.
That his wife and he pulled together. And then day one of ViVE was just amazing. Just soaked everything in, and it's been great.
Yeah, as my audience has heard, and you obviously see, the innovation here is very cool. Just the intimacy of the show, I think it's like 7,600, 7,700 maybe. We'll get the final count here in a few minutes, but it's just been it's a great show. It's small enough where you can kind of see everything you want to see everybody that you want to see, and just not too large where you get kind of lost in the fray. So.
Yeah, no, I completely agree with it, right? And the thing that the organizers do really well with ViVE is they bring out the energy,
yes,
as well as they don't beat around the bush, right? They go, right for the jugular in terms of getting to the value of the connections between the C-suite as well as the movers and shakers, the doers on the ground, right? And I think that is really, really important, especially in this day and age of look, healthcare is in a financial crunch right now.
We need to go.
We need to go.
Yeah.
Right? And on this side of the pandemic,
Yep.
with everything that we need to be doing in terms of prioritization, in terms of action, this is exactly the sort of dialogue and actionability that we need to have.
Love it. So, and I think even, you may not have heard this, but Steve Lieber, I think on Monday, mentioned that they're going to probably cap this at 10,000 people, so it stays intimate, it stays really action-oriented, to your point, and I'm looking forward to that.
Yeah, as am I. Yeah.
And next year in LA, very excited for next year.
That's right. Yeah, sunny Southern California, back to where I was a couple of years ago.
You were. Yeah. So, what are some of the trends that, from your perspective, that we should be looking out for in the industry?
So clearly, right, everyone's talking about ChatGPT and AI, right? The AI bubble, just when people are waiting for it to burst, now gets bigger.
Right, exactly.
And, you know what's going to happen to that bubble as it gets bigger. But, the reality of ChatGPT is it is here. It is exponentially more powerful than we've ever known AI to be, even in the form that it is in right now. But at the same time, for me as a pragmatic physician, strategist, innovator, I'm like, look, we've got so many complexities in healthcare, things that are just direly wrong in the way that we're practicing healthcare. I mean, is ChatGPT going to be the Chat CPT, where it's like solving for the things that make healthcare run,
right?
Don't run.
Yes.
Right? Get it stuck in the mud. So I think there are lots of opportunities. And again, ViVE is a great platform, a great meeting point for us to have these types of conversations and really talk about what's real and what's impactful.
Yep. No, excellent point. What are a few strategies? Obviously, you have a great perspective being a leader there at Advocate and Atrium, but what are some of the best practices that you would share with my audience or strategies to be able to successfully navigate either ChatGPT or what's coming out next? And
so when I left UPMC and joined Atrium Health, which is now Advocate Health, one of the things that I wrote on my whiteboard, so this is in Charlotte. Charlotte is now the headquarters for Advocate Health.
Yes.
And just a quick point on that. Advocate is now the second largest academic health system in the country, and the fifth largest by revenue, which is huge, right?
Yes.
So 75,000 teammates from Atrium came together with 75,000 teammates from Advocate Aurora. Wow. So we're 150,000 together. So it's pretty amazing. And so when I look at the tremendous amount of work that we're doing to serve our communities, to really push the needle forward in terms of the trifecta of health, learning, and community, which are the 3 pillars for our Impact 2025, our strategic plan that we launched last year. The one thing that I put on my whiteboard some years back, which I think is really relevant to the audience here, is how do we inoculate ourselves against the shiny object syndrome? We just talked about ChatGPT.
Right. Yep. Yeah.
Right. We're talking about all of these shiny objects that are out there, but in the middle of that shine are those diamonds, those jewels in the rough that we really need to be embracing and putting into action, and making sure that we're able to then translate that to cost savings, to revenue generation, as well as to making sure that we're able to address the dire needs of our patients and communities on the ground.
Yep. So, even kind of flowing with that, what do you see over the next 3 to 5 years, kind of the proverbial crystal ball? What do we need to be thinking about, keeping an eye on? You say, hey, this is going to be big, and it's not quite here yet. It's evolving, and it could be, we talk about, ChatGPT, CPT. What do you think would be 3 to 5 years out from now?
So, I always ask my team, what's different on this side of the pandemic?
Right.
If the pandemic
right.
hasn't been a wake-up call for us in healthcare and society overall, then shame on us.
Right.
So what's going to be different on this side of the pandemic? I think we need to, abjectly hyper-focus in on the social impact and health equity issues that surround us, that are the root causes of the many ills that, we're facing in healthcare. I think, to be quite honest, if I could be provocative,
please,
healthcare economics is all screwed up.
Right.
There is this tremendous disbalance between, just look at the payers and the providers, man.
Yes. Right.
Look, through the pandemic, we as a provider organization, had to endure months, if not years, of losses, massive losses. And thank goodness that we, got some help from the government, and were able to then work with public-private institutions, really bring together the essence of what it means to actually serve the communities. And I'm not dissing the payers. I think they're here for a reason.
Yes, absolutely.
But they had multi-billion-dollar profits every quarter.
Right.
I think that needs to be addressed, let's just say.
Yep. Nope. Excellent point. Rasu, thank you so much for joining us today. You're obviously always a phenomenal guest. I'd like to keep you back on air every 6 to 12 months or so. But Roberta's saying we should ask one more question. So what do you, as a priority for you over the next probably 3 to 6 months for 2023, what's going to be one of your main focuses as an organization? Obviously, now 150,000 of you came together, so I know there's a lot of work just in that and kind of bringing that ecosystem together overall. But what are your main focuses from an organizational standpoint and a strategy this year?
Right, so lots, and we could talk forever on this, but just to hone in on one thing that I'm truly excited about, we're building an innovation district in Charlotte, right? We're calling it the Pearl. It's 34 acres of amazing.
So you break ground, I think.
That's right. We broke ground recently, just a couple of weeks ago, and really excited about this, right? Because I think our collective job descriptions today is that we're curators of ecosystems, right? And that's what we're doing. Is we're
totally
building an ecosystem. Yep. We're building the most innovative medical school in the country that will, we just broke ground, and it'll be up and running early 2025, right in the middle of the innovation district. We're also bringing in ERCAD. So ERCAD is this global experiential learning surgical simulation center. There are a number of ERCADs in Europe and Asia, one in Africa, 2 in South America, but there has not been one in North America. And we worked with ERCAD and actually built and stood up ERCAD North America, now a wholly owned subsidiary of HLTH, now Advocate. Yep. And that's going to be in the heart of the innovation district. So think about everything from robotics and experiential learning, surgical simulation, AI, augmented reality, etc. Companies like Siemens, Stryker, Medtronic, J&J, Intuitive Surgical. So really excited about that. All partnering, all committed to be part of ERCAD North America. So the innovation district is obviously everything around health, learning, and community. But I'm excited about that being that ecosystem that we're talking about, because I think we need to curate more of that and make sure that we're able to, have the right gravitational pulls that pushes the economic agenda forward and also creates the right jobs as well as the pipeline of opportunities for the next leaders of healthcare.
Yeah, that's a great that's a great component of just Charlotte in general. I mean, yeah, just the care that you're going to bring, the care strategy you're going to bring, the jobs you bring into the area. So love it for that community. Congratulations. You're a great advocate.
5,500 jobs just will be created as a result of the Pearl, and 11,500 jobs in the county as a result of the activities that were. Yeah.
Love it. Congratulations, Rasu. Always good to have you on here, my friend. Thank you so much. Take care. Have a great rest of your conference.
Pleasure.
Take care. Thank you. Gil.
How are you, my friend?
Welcome to the show. Gil Bass, Managing Partner, Chair, Global Health, Fin Partners.
It's so great to see you, Justin.
Thank you
so
see you in
much.
person, my friend. We've obviously been on social media together for a long time.
I know. I was just listening to you and Rasu. That was like A+.
He's always a
I hope you're going to submit that for some Emmy.
Possibly. He's always a phenomenal guest. Blessed to have him as a friend. And
he's real. He's real.
Yeah, he is.
He tells it as it is, and he is bold.
Yes. He is. I love it. And also, obviously, always shares great best practices that we all can learn from and take. And also, you see what he brings to the community of Charlotte. So very exciting. But where are you in from? Where do you live full time? Where are you in from?
Well, I often say that my home is a United Club somewhere on the globe.
Oh, geez.
And that's
being
because
with Finn, that makes sense. Yeah.
Yeah. And we're fortunate to have 38 offices around the world. But actually, what brings me from place to place is really to learn and champion health innovation. And, I know that as we look at this meeting in particular, I walk away at ViVE totally inspired. It's a unique gathering of people, like-minded.
Yes, very true.
What brings us together, I think, is we see the woes of the world, and we're compelled to answer the call to action.
Amen. I love that, Gil. So, you kind of mentioned a little bit there, but how's the show been for you? When did you get in town, and how's the show been for you so far?
Came in town on Sunday.
Great.
I've been meeting with scores of people. We're catching up. This is not my first in real life meeting. This is about my 10th.
There you go.
Since this whole journey began. I was listening to you before that this is among your first.
Yeah, well, this is my fourth one since the pandemic. This is my first ViVE, but this is my fourth show, I think, since the pandemic ended. Well, I guess, a couple years ago, technically. Right. But actually I went to HIMSS for 22 years in a row. But this, right here is, this is my first ViVE per se. But I think we're on a roll here, and we're going to keep this going.
Awesome.
So, but you have a unique perspective, combat medic to CEO, taking on a global health initiative. Why is it so important for us to look globally when it comes to technology, strategy, healthcare?
Well, let me say first that health really is a very personal thing. And you mentioned my background. Certainly from my Army or combat medic.
I'm 11 Bravo originally as well.
Okay, so I'm paratrooper. So,
there you go.
So, you really see how individualized it is, but going through different countries and seeing the needs of refugees, for instance, you get an appreciation for the fact of what people will do to sustain life, to protect their children. Obviously, Nashville has really experienced a horrific tragedy that among many tragedies we have to address in this nation. And certainly as two veterans, we feel it. We know what these weapons of destruction can do.
Absolutely.
And we have to address that. Hopefully people will do that in a bipartisan or nonpartisan way.
Completely agree.
But let me speak to the question that you asked just now. The realities are that health is not just a global issue or a local issue. It's a home issue. It's a housebound issue. What happens is that certain things connect all those homes. Information connects all those homes and their aspirations. But we're facing some challenges around the world that are really limiting the potential of what people here at ViVE are doing. The fragmentation of the health ecosystem has becoming so bad, and Rasu talked about that just a few moments ago. The economics of health are not understood from sector to sector. And when I sit with CEOs from different segments of our industry, hospitals, pharmaceutical companies, retail pharmacy, they actually don't understand how one another makes money. And because we keep on layering in systems into that, our system here in the United States becomes more and more complex. And that inhibits people's ability to actually access care. So health is both personal, household, it's national, and it's global. But we have in this country a very unique health system. Most countries, Europe, some countries in the Middle East, really have a system of we'll call government sort of structured care. We have a system that actually it's payer-based, it's personal-based. We're going to have to start to learn about how to better navigate that system.
Right. Yeah, when I thought one of the directions you were going to go, and you kind of did, but is looking globally to see how they're solving actually their own healthcare crisis. And so I remember one time I had a chance to go to, I think it's 2011. I went to Cuba because they have basically the best birth rate in the world because of the way they take care of the mother and the child. Yes. You have an opportunity to stay at home, but if you don't have 3 or 4 square meals a day for the mother and the child, then you can go into a home and they'll take care of you and give you those 3 or 4 square meals a day.
Absolutely. They're looking at health disparities and they're addressing them on the fundamental level. Let's take that a step further. Yeah. Hong Kong spends about 7% of GDP on health.
Right.
We spend almost 20% of GDP on health. Hong Kong, the people of Hong Kong are living 10 years longer than we are here. Most European nations spend anywhere between 6 and 10% of GDP on health. Again, they're living longer.
Right.
We're living a shorter lifespan, and each generation looks forward to tragically living even a shorter lifespan. So what's wrong with this? You just touched on something that really I think all of us should be aware of. Health just isn't about health innovation.
Right.
It's actually about caring for people in a home. If they lack food, that's a health issue. If someone has asthma and can't afford an air conditioner, well, guess what? They're going to have an asthma attack. So we really haven't gotten to the fundamentals of what keeps people from being healthier. And as a result of that, we push it off until they're really sick. And then, of course, welcome to the emergency room where care is the most expensive possible.
You got it.
We have a lot to learn from the rest of the world.
Yes, we do.
Where they really drill down on social determinants of health.
Yeah, and I'm just not there to your point. Yeah, I totally agree. And I'm a big proponent of everybody traveling as much as you can to learn those best practices, because it's not just about technology. And unfortunately, I think when you were just making your last statement, you made me think about our diet. So not even just a lack of food in certain communities, in certain areas, and food deserts, but rather how we don't take our food intake as seriously as we truly need to. Because when you bring up those other societies in Hong Kong, they see that food is different to them. They're not eating all these trans fats and these saturated fats on a regular basis. They eat a lot more fish and a lot more healthier food than we do in our...
Well, you're really talking about the rise of the urban diet.
You got it.
And so when we look at China, for instance, diabetes in China is now skyrocketing.
You got it.
Right, and it's really a reflection of their prosperity is also a downfall.
You got it.
And so we really have to get our arms around this. Now, I just want to touch on something since you brought up social determinants of health.
Absolutely.
We tend to strip away from school budgets healthy lunches and actually playtime, gym. These are actually, we're starting to realize now that these are really setting the tone for a healthy population. We think that they're extras that are not necessary, put the money into academics. Well, guess what? If we don't start to invest in the future of our young people here in a way that sustains their well-being, we will all suffer, because clearly the economic path we're heading on because of illness is unsustainable.
You got it.
I actually say, when people say about our healthcare system, I actually sort of tongue-in-cheek correct them. I say, you mean our sick care system?
There you go.
We're very good at caring for people when they're ill, but we don't do anything to inspire their knowledge around self-care.
So true.
The health system actually has to take responsibility for that.
I love it. I totally agree. And I'll even further your point one more with a good friend of mine, Laura Turner-Sardell, educated me. Now it's like 10 years ago, but we actually had a whole forum about food in the creation of food deserts, but also we talked about, you brought up cafeterias in school districts. This is going to, I hope, embarrass a lot of people, and I certainly want this to embarrass a lot of school districts and school superintendents who made this vote. A lot of school districts, if not all of them that I'm aware of, allow ketchup to be a vegetable.
Absolutely. It's a tomato.
Ketchup is a vegetable. That is, ketchup is not a vegetable. Ketchup's first ingredient is sugar.
It's a condiment, nothing more than, and it's sugar.
It's sugar. You're injecting sugar into your child at the age of 5, 6, 7, and that's why, to your point, that's just one fundamental piece, but I learned that, and I was in shock that they allowed ketchup, which is a condiment, to your point, as a vegetable, because you had a vegetable. That's part of what the FDA and the government put down in regulation for these schools, is you have to have a vegetable and have to have these different components, so we have to the rules.
Listen, we have to have the courage. We have to have the courage to build a healthier society.
Absolutely.
Now, what we don't realize is, to some extent, is because we have economic fragmentation to a large extent, the health system, the educational system, the policy system, all look at their budgets very separately.
Very true.
And no one is saying, wait a minute, if we don't invest here, we're going to spend money over here.
You got it.
Right. And so this is really unsustainable as a society, where other countries are really managing their economics more holistically. I don't have an answer for that, but I do say...
Well, I think you already said it. I think we need to look interoperate together to collaborate better. I mean, I think that was your kind of point.
But, at the same time, when we look at health information, and one of your guests on the program was just talking about sharing information, the EMRs.
Yes.
We don't even make EMRs really centered around the patient or even the provider, the health professional. I remember speaking to a nurse about a particular patient. She said to me, I don't have time to read the EMR. So how is that EMR working for that patient?
Right.
If the nurse on the floor doesn't have sufficient bandwidth to access the information. So we're really struggling here. Now, that doesn't mean that we have to continue to struggle. I think to some extent we have to take ownership of the sort of the missteps of the system and start small. It's a big elephant to bite into, a bite at a time, as they say.
Got it.
We have to start to fix some of these fundamental issues. Regarding our school system and healthy lunches and, again, education, let's build a healthier next generation. We can start there, and we can succeed.
Completely agree, Gil. Thank you so much for joining me on air.
Always
Phenomenal guest as always. Thank you, my friend.
Thank you, my friend. Thank you.
Got it. Take care. Have a great rest of your show. Go Bashe, everyone. Thank you. All right. Rich, welcome back to the show, my friend.
Thank you.
Good to see you in person.
Good to see you.
Excellent. Rich Scarfo, President of Health, and obviously one of the leaders here for ViVE. Thank you for having us and allowing us this great opportunity.
Yeah, glad to be here.
So how's it been for you?
It's been an amazing week.
Yeah, I bet. So what's the final count? Where do we end up?
So we had a goal of 7,500.
Yep.
We came in at about 7,612.
Beautiful.
Yeah.
I love it. I had Steve Lieber, I guess maybe yesterday morning, but he kind of gave us that latest update,
Yeah.
so that's fantastic.
Yeah.
Great success. Steve also let the cat out of the bag a little bit. So there's a cat running around here. No, sorry. No, he said that you guys might cap this at 10,000 or so, or maybe cap this in some area, keep the intimacy.
It's really important to us that the show remains right-sized. The goal here is not the number. It's really the right audience. Our focus with this week and with the initial event was to make sure that we're bringing the right companies together, the right attendees. We really focus on the senior level, VP and above. And even with an event of this size, the goal is to make sure that the experiences feel a little more intimate than a kind of a mass market trade show. And so in terms of looking at the numbers, we'll carefully manage that the same way we do with health.
Yes.
And that is we want the right people. So if the numbers go up and the percentage of C-suite goes down, that's not success to us.
Excellent. Love it. So in the last kind of hours and day here, has the second annual show been what you want it to be? And
I think it's exceeded our expectations in a wonderful way. One of the common things I keep hearing is that this does not seem like an event only in its second year.
Right.
That it really has evolved since last year. We had a lot of challenges last year. We were, I think, at the end of the second variant. There was a busy schedule for shows.
Yes.
People weren't really traveling. Hospital systems were really struggling. And we managed to pull off, I think, a really strong event last year. In looking at it this year, we wanted to make sure that, the experience for everybody, so whether that was our speakers, our sponsors, or our attendees, was really something we paid a lot of attention to. We were able to bring about 320 companies to Miami, and this year we have 602. But the other thing, going back to, the size of things, you won't see many things here above 600 square feet. And that's another thing that we really focus on. So in terms of those numbers, we don't want a lot of booth staff, massive booths. We really want our customers and the sponsors and exhibitors to be able to spend time with their customers and doing other things, not just standing in a booth.
Right. We had my first guest, Dr. Dan Nigrin from MaineHealth, said how this show levels the playing field, and I love that analogy because you have these innovators. Everybody's kind of side by side. There's no 120 by 120 booths or whatever, and we don't drown out anybody. So everybody can kind of find each other. We can collaborate at a higher level, and it's so I'm extremely impressed. And just so you know, last year I met several people coming off ViVE in Miami Beach, and they were electric. They were still electrified 3 or 4 days later, and so I'm like, and I missed it because it was a busy trade show season. But I said I was never going to miss it again because the electricity hit us and it was phenomenal.
It's been good. And, what we try to put a lot of elements together that generate some excitement. We have a very specific look that we focus on. All of our artwork is created by our team internally.
Strong.
As well as the digital assets. Everything is done in-house. And, this goes on. They'll start for Los Angeles shortly because a lot of work goes into that. And we build a whole theme and look around it. And it might seem trivial, but what we try to do is take the things that people are used to, trade shows, and make it more of an experience, not just going to another event.
I can see that. It's phenomenal. Any breakout successes this year that you want to highlight?
Well, I think Hosted Buyer was one of the big ones, and actually Funding Founders. So that was a surprise in terms of the sheer numbers. So Hosted Buyer, last year I think we did about 700 meetings. This year we did 3,000. We have 330 buyers in that program, and that's an important program for us because going back to the size of the booth and the activations here, it's okay with us if a company comes and takes a meeting space and Hosted Buyer meetings and a few other things. But that's one of the very important parts of the event because it uses the time of the buyer and for the sponsor very efficiently, and they choose who they want to meet with and set time. So that went extremely well. Funding Founders, on the other hand, at the other end of the hall, that's where we bring VCs and startups together. And we did 1,800 meetings there, and last year we did like 400.
Wow.
And what that says to me is that this event, as much as it is different from health, still depends on a strong thread of innovation and new companies that we're bringing in. And, we try to make the event as accessible to the startups as we do to the larger companies. So the last thing I'll say on that is, as a startup, they don't actually have to exhibit to be in Funding Founders. If they're attending and an approved startup, that's an opportunity that they have here, which is important for us.
That's very unique.
Yeah.
Yep. So what does partnering with CHIME bring to health for a different experience? I've been part of CHIME for a long time, love CHIME, but tell us.
CHIME's been a great partner, and going back to the audience focus, two things that are very important to us, the C-suite and CIOs especially, and then having an organization that has really an intimate relationship with that group has been very important. They also bring a lot of thought leadership to the event that is important, and then relationships with hospital systems. So these are three very important things that CHIME delivers to the event that I think has been critical in its success.
Completely agree. Any announcement for health this fall you want to mention here?
Well, health will be in a new building once again. We were talking last week. It will be in our 8th event before we go back to a facility that we've been in before. Health is going. It's really focused much more on the innovation spectrum.
In Vegas, correct?
It's in Vegas. It's at the new West building of the convention center, October 8th through 11, and registration actually opens on Thursday, which is crazy.
Good. Should we do that too?
Yeah.
Love it. No, health is. I went to health for the first time last year, or I guess, last fall, and the energy there was phenomenal, and so you can see it certainly carried over to here. What can we expect for ViVE in LA in February?
I think LA is going to be a great host city for us.
Agree.
We try to pick cities where we can lean into the city in different ways. Here it was music and the healthcare community. In LA, it's we have a lot of hospital systems, a lot of companies there. It's a different setting. We want to give people a different experience. We're really focused on we've had a lot of meetings here. We'll have quite a few more companies at that event, a lot of new entrants into the space. And I think, for us, it's to really step away from this and understand the experience that people had, where there's room for improvement, because we always are open to that, and we actually, welcome the input and even criticism. And then just to come back with another thoughtful event that is, full of fresh speakers, original content, these intimate settings that we are creating. So going into convention centers is a little bit challenging, and that's part of the reason that we sort of take things over and give it a different look. But I think LA will be a great city for us.
Have you picked a location, a facility there in LA?
Yes, we're at the Los Angeles Convention Center, which again, this is a convention center, so we're already working on transforming it. Our creative team was there a few weeks ago, and I think we'll have to step it up for LA, but I think
you guys did a phenomenal job. I was extremely impressed. The quality of conversations here, the quality of vendors, the innovators, you guys have it all. So
thank you.
Thank you, my friend.
All right.
Scarfo, President of Health, thank you so much for joining us. Thank you. Take care.
Thanks.
Thank you, Rich. And then Branzell, last but not least, the infamous. How are you, my friend?
I hope I'm not infamous, but...
Oh, perfect. President and CEO of CHIME, a longtime leader in digital health and health IT, a longtime friend of mine. Welcome to the show, my friend.
Thank you very much. Pleasure to be here.
Fantastic. So how's it been for you so far?
At this point right now, exhausting. I think we're starting to see the adrenaline start getting on fumes.
Absolutely.
But this has been an amazing, for us, over a week, because CHIME's actually been here doing our academies last week and now rolling right into an amazing ViVE event.
Yeah, no, I'm on fumes myself. I think, this is my third day broadcasting. 20-something guests, and but it's been invigorating. I love the conference. I'm so proud of what you and Health have done creating ViVE. I mean, what you undertook was a massive lift. You guys crushed it.
Well, I appreciate that. If you put it down on paper, so everybody would say, why in the world are you doing this post-COVID? Not really during COVID, and then now into an economic recession. I mean, but again, you do the right thing for the right reason.
It works.
It works.
It does. And I have not heard, I've only heard phenomenal things about the conference. Everybody that I've met with and spoken with will all be at Health, actually, and also be at ViVE next year. So you're onto something here.
I think we figured a little something out.
You have. So talk about a little bit of what you guys are working on, your CIO boot camp, CHIME focus groups. You also got your fall forum coming up. So talk a little bit about that.
Yeah, well, what's amazing right now, similar to ViVE, is what we're seeing now is amazing demand for leadership.
Yes.
And I think that's the part that in dynamic times, difficult situations, people have to lead. And what we're seeing now is a real demand for leadership development, leadership certification, and really people figuring out how to lead in a disruptive way during a really turbulent time in healthcare worldwide. The problems are not U.S.-centric. The problems are truly a global issue. And so what we're seeing now is a demand for our academies, our boot camps, at a global level. I'll be leaving here fairly soon, heading over to the U.K., then to Israel, and then probably back to the U.K., and then Ireland, and wherever
Amsterdam at some point, right? Isn't there a ViVE over there sometimes?
And then we have a group going to Finland. We had a group that just got back from India. And so what we're really seeing at this point is a global demand for people to get better. And I think that's what we try to tap into, is a demand for people really wanting to get better. We do have our fall forum, which we often refer to as the CHIME Family Reunion.
Yes.
You used to be part of that and still are.
Yes.
A vital part of that. And it's a place where people can come together, similar to portions of this, but a little bit different, in a safe way, and really lean on each other to get better. And really also maybe to de-stress a little.
I completely agree. No, I always take a moment to share with my audience. This is the importance. If you haven't collaborated, if you haven't learned from your peers, you're really missing out. And if you haven't engaged, CHIME and these organizations that share so much leadership, they share so many best practices and key strategies for you to be successful. And our industry is so amazing. Now it's my 25th year in the industry, and how many times I have just turned to so many people just to help me navigate my daily workflows, my daily stress, whatever, coming at you. I was just talking, phenomenal people like Carl Dvorak and even Mark Siegel from back in the day, and Charlene Underwood, and these are the most amazing people, and Lee Burchell and Meg Marshall, and just these people. My hair stand up when I think about all these phenomenal people who helped me back in the day.
Exactly.
For many, many, many years, and to be honest, many decades. And so those people were so instrumental in me becoming the best executive that I could be in healthcare and health IT and digital health to where I got, all through organizations like yours. And so, I always take a moment to ask people to please just slow down long enough to learn.
Exactly.
So much happening. It's coming at you. You brought it up, and a lot of my guests brought up how complex it is right now, how difficult it is. We have budgets that are under a lot of constraints. We have to do more with less in most areas of our businesses. And in organizations like yours, and obviously the fall forum coming up, the boot camps, they teach us how to navigate all that. So, a little bit about the fall forum. Where's it going to be, first of all?
It'll be in Phoenix, the JW Marriott, in November. And so we've been told never to interfere with Halloween. It's becoming the biggest holiday for families to spend together. So we'll be, right after Halloween, we'll be together in Phoenix again.
Yeah, so I guess the importance of what it's been to my past, and so I guess why don't you share your experience, because you've been on all different sides of CHIME, you're a former CIO, but share some of your experiences of how you've leveraged learning with other people and collaborating with other people to get better and be your best.
Yeah, I think it's interesting because you and I are close to the same age. You look a lot better, but we are close to the same age, and it's an interesting process when you really think about it. You named some of those giants in the past, but it's so easy to name others. Stephanie Reel and John Glasser and Ed Kopetsky and so many people. They've dedicated their lives not only to our industry, but more importantly, they've dedicated to replicating leaders, and I think that's the true trait of a great leader. Lots of good leaders create followers, but really great leaders truly do create more leaders. And I think that's the part that I think I've watched over the last, for me, 27 years involved with CHIME.
Yes.
And it's amazing to watch people who have dedicated their lives to making other people better. And I think when you find that, whether it be an event like a fall forum, it doesn't matter. It could be 365 days a year. There was always somebody there for you. There was always somebody there for me at any moment. A phone call, a note, something that said, I think you need a little help right now, or can I be there for you? Or sometimes you didn't even know you were screwing up, and they would give you a nice little swift kick in the tail or a pat on the back to get you moving in the right direction. And I think that's been my experience now since the very beginning, when I walked in as a young military CIO who had no clue what any of this stuff meant at all. And people like John Glasser, for some reason, wrapped their arm around me, and people like Ed Kopetsky and Skip Hubbard, and I'm like, I just don't get it. Why are they doing this? What are they trying to get out of this?
Right.
And as it turns out, they were getting out of absolutely nothing. They were just givers that were filling up cups, and I hope we can all be that now as we continue to work for other people.
It's true, and that's why I take a moment to talk about it, because you got to start somewhere, and what we're navigating is just so complex, and so you've got to engage, and your organization. So talk about, I guess, the importance of ViVE for CIOs, and kind of why you created this forum, and specifically for that audience. I know it's not just CIOs, there's CSIOs, and there's a lot of other C-suite executives, but why ViVE and CIOs specifically?
So this was a very targeted and strategic thought process. This wasn't just create another conference.
Right.
We don't need another conference.
Right.
What we needed was a forum and a place where the thought leaders, the senior people that are trying to figure out this crazy industry that needs to get fixed, could come together and try to at least talk about, maybe share, and in a rare case actually truly fix some of these monster problems that are out there. I've said from the very beginning, I was never really smart enough to come up with some true innovative thought, but boy, I could get really good at stealing other people's ideas.
I love it.
And I think if we figure out how to work smarter, not harder, if you're the best at X, then I'm going to try to emulate you. And if I can do that, then my curve of learning and adoption is a fraction. If we did that across this entire arena, then we can do things so much faster in this industry instead of, I have to create it here. You saw it as a CIO. I know you did. We have to fix it here. No, we don't.
Right.
Let's steal it from smart people and put it in. And I think that was our intent. Bring all these brilliant people together, our partners in the vendor community, the really smart people at the leadership level, to really start working and sharing. I mean, the numbers are staggering. Over 75% are director and above. Over 50% here are vice president above. What does that mean? We have the people empowered to make change, and we want those people to be here and feel like they can share in open, transparent ways to fix these problems.
I completely agree. And even to your last point, yesterday I was walking the show floor and with a former business partner and a great leader in the industry, and we kept on going up and down every single aisle, and I'm like, why are we going up every single aisle? We're just kind of catch up because we've not seen each other in a while. He's like, because I want to look at every single innovation here, and I want to see what I can steal or partner with. He's like, because your point is they don't want it. They don't want to recreate the wheel. There's a lot of phenomenal wheels here, and so where can we partner? Or just a good idea, like, you know what, I can go create that. Then that's great. But when you partner with this company because you can't create it, that's phenomenal. But don't go recreate the wheel. But you have so much phenomenal innovation here. at ViVE this year. So I mean, I'm a big proponent, and I will certainly be back, and we'll certainly be at Health this fall, and we'll certainly be at ViVE next spring, and possibly even Health over in Amsterdam. But you know what you guys have been able to do here and create is phenomenal. So I mean, what's your hope for what people will take from this conference? We're wrapping up here in the next 4 or 5 hours or so. What do you hope people will take away from this?
Well, I think there's two ways to look at this. There's what they personally should take away to take back into their organizations. And again, I'll actually say it doesn't matter whether it's our supplier partners here or it's somebody back to a provider organization or insurance. They're going to take back. They know they're not alone, and there's people they can share with, and there's a safe place for them to do that. And you think, okay, you're on a big giant exhibit floor. Actually, it's not. You can walk from one end to the other in about 5 or 10 minutes.
Got it.
You can see this whole place in a couple of hours.
Yes.
And I hope we don't get much bigger. I really don't, because this is the kind of environment where people feel safe and can do that. The other part of this is as you start thinking about it as an industry, it is time to start dealing with our toughest issues, whether that's equity issues, whether that's access to care issues, or whether that's just the economics at a macro level. We've got big problems we need to fix. And I look around at the people here. They're brilliant. They're smart. Yeah, they're making great products or services, or they're great leaders in their provider organizations. You put all this into one soup, we can fix a lot of things.
That's excellent, Russ. Fantastic, my friend. Thank you for having me. Thank you for allowing us to share the stage here with you and your great organization, my friend.
Thank you. Blessings as always.
Yeah, same to you, Russ. Russ Branzell, President and CEO of CHIME. Thanks again, my friend. And that is a wrap. That is what a great show, what a great time. Thank you so much to CHIME for inviting us to the theater, my producers, Roberta, Greg Masters, Carol Flagg. You guys have been phenomenal in bringing this all together. I'll be honest with you, all the kudos goes to them because I didn't do a whole heck of a lot but sit here and talk. So you guys did a great job. Thank you so much. We'll do it again. Thanks all.